more than 1 in 3 patients go into knee replacement with a big problem. That problem is their nutrition, and it increases the risk of infection, muscle loss, and slower recovery. But the good news is that you can improve your nutrition in the weeks before your surgery, and doing so can seriously enhance your recovery. In this video, I'm going to walk you through 4 nutrition traps that can hurt your knee replacement recovery, and exactly how to avoid each one before surgery. I'm Dr. Bounajem, Dr. B for short, and I'm a board-certified orthopedic surgeon who specializes in hip and knee replacements. I see patients all the time who have done everything right for their physical preparation, but who've missed the nutritional factors that can make or break their recovery. Here's how to fix that. The first trap is low protein intake, and it's a big one. Surgery triggers a catabolic state in your body, which means that your body starts breaking down muscle for energy. Here's the hard truth. Patients who don't do anything about it can lose up to 14% of their thigh muscles in just 2 weeks after surgery, and that muscle loss can seriously derail your recovery. If you go into surgery with low protein reserves, you're starting that muscle loss from an already weakened position. In fact, most patients don't meet their protein goals before surgery, and the numbers are actually shocking. Some studies show that as few as 1 in 5 patients get the recommended amount of protein. In the 1 to 2 weeks before surgery, current guidelines recommend about 1.2 to 1.5 grams of protein per kilogram of body weight per day. In pounds, that's about 0.5 to 0.7 grams of protein per pound of body weight per day. In other words, if you weigh about 90 kilograms or about 200 pounds, guidelines recommend about 100 to 140 grams of protein daily. So once you check with your medical team to make sure these targets are right for you, how do you actually hit them? Start by calculating your personal protein goal according to your weight, then track your protein intake for a few days to see where you stand. Smartphone apps can help to make tracking much easier. High-protein foods include lean meats, dairy, legumes, and nuts. But the truth is that many patients have a hard time hitting these numbers through their diet alone, and that's where protein supplements come in. A typical protein shake contains about 20 to 30 grams of protein per serving, and adding 1 to 2 shakes per day can help bridge the gap between where you are now and where you need to be. There's also some research specifically on essential amino acid supplements. Essential amino acids are building blocks of protein that the human body can't make on its own, so they need to be consumed. Small studies in knee replacement patients show that they may help reduce muscle loss after surgery, but we don't know the best dosing protocols just yet. Essential amino acid supplements are available over the counter, so if you're considering them, they're worth discussing with your medical team. The second trap is low vitamin D, and it affects your recovery far more than most people think. Vitamin D plays a critical role in at least 3 different areas that directly impact your knee replacement recovery. First, it influences bone health, which is important because your new implant needs to integrate properly with the bone around it. Second, it supports muscle function. Vitamin D deficiency leads to muscle weakness, and that's the last thing you need when you're trying to rehabilitate your new knee. And third, it supports your immune system, which is important in fighting off infection and healing your surgical wound. Research has linked low vitamin D to longer hospital stays, worse knee stiffness, and higher infection rates. Here is what's really concerning. Some studies show that more than half of all knee replacement patients have low vitamin D levels going into surgery. That means that most people who get the surgery have this correctable issue that is hurting their recovery, and they often don't even know it. Vitamin D is measured through a blood test called 25-hydroxyvitamin D. Guidelines recommend at least 30 nanograms per milliliter before surgery. You can increase vitamin D by eating foods like fish and fortified dairy products and by getting more sunlight. But if you're below 30 nanograms per milliliter, your medical team may recommend vitamin D supplementation. The most effective form of vitamin D to take is vitamin D3. D3 has been shown to increase vitamin D levels to a greater extent and longer period of time than D2. The best dosing protocols are still being studied, but one plan that has shown success is a high weekly dose for 4 to 6 weeks, followed by a lower maintenance dose daily until surgery. Shorter supplementation timelines have been studied, but these may not increase vitamin D levels quite as effectively before surgery. These supplements are available over the counter, but excessive intake can pose serious health risks, so check with your medical team to make sure that supplementation is right for you. The third trap is anemia, which is low hemoglobin or red blood cell counts. Anemia itself technically isn't a nutrition problem, but one of the most common causes of anemia is a nutritional deficiency. This one often gets overlooked, but going into surgery with anemia can have serious consequences. Knee replacement surgery has become so common, But here's something many people don't realize. You can lose 20 to 30% of your total blood volume from the surgery. Much of that happens after surgery, when bleeding continues into the knee joint and surrounding tissues. If you go into surgery already anemic, you're more likely to reach even lower blood counts after surgery. Red blood cells are necessary to deliver the oxygen that's needed to sustain life, so it makes sense that anemia is linked to higher rates of infection, organ damage, and even death. And what's shocking is that even patients who receive blood transfusions after surgery are at higher risk of these complications too. The best solution isn't treating anemia once the surgery is over. It's treating anemia before the surgery has even started. Hemoglobin is the protein that transports oxygen within red blood cells. Anemia is often defined as hemoglobin levels below 13 grams per deciliter in men and below 12 grams per deciliter in women. About 15 to 30% of patients are anemic going into surgery. The most common cause is iron deficiency, while others have anemia related to chronic disease and inflammation. Regardless of cause, the typical target before surgery is a hemoglobin of at least 12 to 13 grams per deciliter. If you're iron deficient, your medical team may recommend iron supplements. Vitamin C can help improve iron absorption and is found in foods like bell peppers, strawberries, and, of course, oranges. That being said, oral iron supplements can cause stomach cramps and constipation, and they can also take weeks or even months to bring hemoglobin to target levels. If your surgery is coming up soon or you can't tolerate oral iron, your medical team may recommend intravenous or IV iron, which can work in as quickly as a few weeks. For anemia due to other causes, your medical team may refer you to a hematologist, nephrologist, or other specialist. The key is catching anemia early to give yourself enough time for treatment. The fourth trap is uncontrolled blood sugar. You've probably heard about this one, but the actual data may surprise you. High blood sugar impairs wound healing and weakens your immune system's ability to fight infection. And I'll be direct with you. Infection is one of the most serious complications after knee replacement, often requiring additional surgeries and prolonged antibiotic treatment. Diabetes and prediabetes are conditions of high blood sugar, and hemoglobin A1C is a lab test that is used to check blood sugar control over the past 3 months. An A1C of less than 5.7% is considered normal. 5.7% to 6.4% is prediabetes, and 6.5% and above is diabetes. About 20% of knee replacement patients have diabetes, and when including prediabetes, it jumps to about 50% of all patients having the surgery. Even if you don't have a history of diabetes or prediabetes, it's worth checking A1C before surgery because some patients have high blood sugar without knowing it. Research shows that as hemoglobin A1C increases, risk of infection increases significantly. In one study, patients with an A1C at or above 7.7% had a nearly 7 times greater infection rate than patients with an A1C below 7.7%. That's a lot of sevens, but it's true. As a result, many surgeons recommend bringing the A1C below this threshold to help prevent infection after surgery. If your A1C is elevated, work with your primary care provider and your endocrinologist if you have one to improve it. A nutritionist can also help improve your A1C through food choices, which often means eating more foods with complex carbohydrates and fiber rather than foods high in sugar and refined carbs. Exercise like cardio and resistance training can also help to lower A1C, although this can be challenging if your knee pain is limiting you. Lastly, there are many medications that help control blood sugar. More recently, medications like GLP-1 agonists are increasingly being used. You can talk to your primary care doctor or endocrinologist to see what medications might be right for you. Because A1C reflects a 3-month average of blood sugar control, meaningful improvements take time. This is why blood sugar awareness and management should start as soon as surgery is being considered. To wrap things up, let me put all of this together into a practical timeline. Of course, identifying and treating all of these earlier is better, but here are the minimum timelines to keep in mind. 12 weeks before surgery is generally a good time to get labs and start working on blood sugar and anemia. These two often take the longest to correct. Your medical team can guide you on blood sugar medications, iron supplementation, food choices, and specialist referrals if needed. 6 to 8 weeks before surgery, vitamin D is the next target. Vitamin D3 supplements often help meaningfully in this time frame. And of course, blood sugar and anemia fixes would continue in this time period as well. 1 to 2 weeks before surgery, protein intake can be adjusted, and amino acid supplements may be started. The key takeaway? Start early. The sooner you work to improve your nutrition, the more time you have to fix problems. Now, nutrition is just one piece of the preoperative puzzle. Physical preparation matters too, and the two work together to improve your outcome. They're more powerful in combination than either one alone. I've made a video on preoperative exercises that can help patients recover faster after knee replacement, and I'll put that video right here. If you found this information helpful, consider clicking that like button. It helps other people find this video when they need it most. Stay well, and I'll see you in the next video.